Hi, my name is Catherine Barnett, and in this presentation, I will talk about current issues in psychometric testing and their particular relevance to the profession of clinical psychology. Firstly, what is psychometric testing? Psychometric testing is the scientific measurement of psychological constructs such as intellectual capabilities, behavioural styles, or moods. These constructs are generally not directly observable, which creates unique challenges for psychologists and brings with it unique problems. From personality testing to determine job aptitude, to cognitive testing to determine brain pathology, tests have been developed in a range of areas to measure both stable traits and more transient states. The main types of psychometric tests are ability tests, personality tests, and mental health tests. These cover intelligence, structured tests, projective tests, and tests of mood. The study of psychometric testing is a requirement of all psychology degree programs, regardless of specialization, and is considered a core competency across all areas of the psychology profession. As Kaplan and Sakuzzo note in their text on psychological testing, all psychologists study behavior, and they all depend to some extent on its measurement. Organizational psychologists, for example, may need to be proficient in personality testing, as it is used in industry for selecting appropriate employees. Neuropsychologists need to be competent in cognitive testing, as this is the primary method of assessment of brain pathology. Testing is used to assess, diagnose, and plan interventions for a broad range of psychological issues. As defined by the Australian Psychological Society, clinical psychologists work in the assessment, diagnosis, and treatment of psychological problems and mental health. These problems range from mild, such as anxiety or depression, to severe, such as schizophrenia and other personality disorders. A clinical psychologist works with people across the lifespan and may work either with individuals or with groups. Face-to-face interviews are the primary method of contact for clinical psychologists, and within these interviews, they may use a variety of tests depending on the situation. Both structured and projective personality tests may be used to assess severe disorders. Ability tests may be used to assess developmental disorders, and self-report scales may be used to assess emotive states such as depression or anxiety. Clinical psychologists may use information derived from tests in combination with clinical interviews to diagnose a client and plan interventions and treatments. The measurement of aspects of human ability and behaviour is complex, primarily because most of these constructs are not directly observable or measurable. Humans are incredibly diverse and are also constantly changing, which makes reliable measurement challenging. This issue pertains particularly to psychologists working at the research and test development level, but it is also an important consideration for clinical psychologists as they see clients face-to-face and must interpret test results in light of what they know of the individual client. Disorders of emotive states are the most common problems treated by clinical psychologists, so both theories and tests need to be thorough. There are a variety of issues associated with psychometric testing, including validity, reliability, bias, moral, misuse, and dehumanization. I will talk briefly about each of these key issues in the following slides. Validity is the extent to which a test measures what it says it measures. Kaplan and Sakuzzo emphasize the fact that the concept of validity represents all the evidence that supports the measure in question. As with all scientific endeavours, the nature of evidence is that it is constantly evolving. As scientific practitioners, clinical psychologists must be aware of this constant state of flux and remain abreast of developments in their area to ensure that any measures they use continue to be valid. This is one reason why professional registration requires ongoing professional development to maintain registration. In Australia, a clinical psychologist is required to complete 30 hours of continuing professional development every year. Reliability is how accurately a test measures the construct in question. In general, reliability must be addressed during the construction of a test and is often the domain of research psychologists. However, there are certain occasions where a clinical psychologist may make a decision that will affect the reliability of a test. One of the key methods for increasing test reliability is to increase the number of items. Many scales used in clinical psychology have both long and short forms. Shorter versions are frequently more popular as they can be less confronting for the client, as well as potentially saving time and money. The Depression, Anxiety and Stress Scales, known as the DASS, is a popular measure in Australia. It contains 42 self-report items, which the client rates on a 4-point Likert scale. The DASS-21 is a shortened version of this, and although it has good psychometric properties, a clinical psychologist may be able to increase the reliability of the test by using the full version. This could be particularly useful to gain more detailed insight, or perhaps if the client's presentation was not consistent with their responses on the DASS-21. Another aspect of reliability is the risk of ceiling effects. This is when an individual scores highly on all items of a test, leaving few items to discriminate whether functioning has been accurately measured. Research from the University of Western Australia's Andrew Page and colleagues found that the depression subscale of the DASS showed ceiling effects, which could affect its validity in a clinical context. This is related to the problem that many of the available scales do not measure severity. Often measures in these realms return similar results in both clinical and non-clinical samples. So they accurately discriminate emotive states, but don't give an indication of the severity of the symptoms. A clinical psychologist needs to use their judgment in the interview to determine the severity of each individual and not rely solely on the results of the test. Bias in psychometric testing can prevent accurate and impartial measurement. One of the key sources of bias in psychological measurement is cultural. This became evident at the beginning of the 20th century during the rise of intelligence testing. Cohen, Sverdlik, and Stueman's textbook on psychological testing use the term culture loading to describe the extent to which a test may incorporate vocabulary, concepts, knowledge, or traditions of a particular culture. This could be particularly important during assessment for developmental disorders, which require ability tests that may be culturally loaded. Increased research in this area over the past 50 years means that many tests now have culturally specific and validated versions. To return to the DASS, although it is reliable in Western samples, research from the University of Queensland showed that there were some issues with Asian samples. This research found that the DASS was more effective in an 18-item format for patients from this background. A clinical psychologist must ensure that they use a test that is appropriate for the cultural background of the client. Issues of validity, reliability, and even bias can often be addressed during the development of measures and thus are highly relevant to research psychologists, even though clinical psychologists can make important choices to improve these. But perhaps the most important issue for clinical psychologists is the misuse of tests. The choice of which test to use and when could have a large impact on the client. Overwhelming a depressed and anxious person with multiple tests in a first appointment may not be the best way of building an effective therapeutic relationship. Using a test without being fully informed about it or without adequate training would also constitute misuse. An example of test choices may be found in the assessment and diagnosis of borderline personality disorders. As a personality disorder, common sense tells us that the administration of a personality test would be an appropriate choice. However, research has shown that borderline personality disorder patients generally perform normally on structured tests. To reveal the idiosyncratic and disordered thinking of this disorder, projective tests are often more reliable, despite ongoing controversy about such tests in the scientific community. A clinical psychologist needs to decide which tests would be appropriate and to be fully trained in their administration. Personality testing is often used in the area of determining job aptitude, so thus it is often in the domain of an organisational psychologists. However, all psychologists should consider the issues not just of misapplying a personality test, but of misusing the results. Kaplan and Sakuzzo caution particularly about the worrying trend for test data to be stored and analysed by computers. This could lead to a state where machines are making important decisions about human lives with no consideration of individual differences. Misusing a test may have implications for the individual and also high costs to society. Misdiagnosing a person with a severe disorder, such as borderline personality disorder, could lead to stigmatization, which may result in issues with retaining jobs and maintaining relationships. Admitting an individual into an inpatient psychiatric care is expensive, so adequate assessment is critical. As mentioned earlier, the depression subscale of the DASS is subject to ceiling effects, and the results of this could go either way. Admitting all people who received a maximum score on this could be costly and ineffective, as well as unnecessary. However, never admitting people who received the maximum score could be detrimental for a person who may be suffering depression at a level far above that shown by the DASS and could be at risk of suicide. The use of a variety of measures when the stakes are high is important. The Beck Depression Inventory, for example, includes items about self-harm and suicidal thoughts, which may be helpful in discriminating individuals at high risk to themselves. Many psychometric tests were developed in response to a particular need. The rapid growth of intelligence testing was the direct result of the 2 world wars and the need to recruit appropriate personnel as efficiently as possible. Under such circumstances, the dehumanizing effect of such testing was a lesser concern. But in the 21st century, we are acutely aware of and sensitive to individuality. Taking tests can make people feel like a number, or that their problem is just a number. Testing minimizes individual freedom and uniqueness, and in many cases, the benefit of the test may not outweigh this. Tests and diagnoses frequently lead to labels, which can also be restrictive to an individual, who may then be perceived as their disorder, and their unique personality may be overlooked. My youngest daughter has ASD, and I've noticed that a lot of parents are very conscious about saying that their child has autism, rather than saying that their child is autistic. While this is probably an important distinction, it doesn't necessarily remove the stigma of a label. Clinical psychologists are in a position to educate their clients about their diagnosis and condition and alert them to the problems of labeling. In some cases, such as a child receiving assistance at school, revealing the diagnosis is obviously necessary, but if not required, psychologists and clients alike should consider carefully who needs to know about the condition. In conclusion, psychometric testing is evolving rapidly in response to our ever-increasing knowledge bases. It seems likely that testing will continue to be a part of psychological interventions, despite the many issues associated with measuring latent constructs. Clinical psychologists can mitigate against problems with testing by ensuring they choose appropriate tests, are adequately trained and informed, maintain high privacy standards, and educate clients effectively. Labeling is sometimes necessary, especially if social welfare or intervention funding is required, but should be considered sensitively. Thank you for listening to my talk.